County, suspected of having contracted the Ebola virus disease, has tested negative. Well, this coming amidst calls from a section of healthcare workers for the government to step up its surveillance and efforts to keep the deadly virus at bay. KMPDU Secretary General Dr. Davji Brimji Atela says healthcare workers who are supposed to be at the front line in managing the virus lack the necessary personal protective equipment and know-how in surveillance and management of the deadly virus.
Anxiety had gripped the country since the first suspected case of Ebola was reported on Friday in Kakamega County. A 32-year-old man said to have traveled to Uganda recently was quarantined at St. Mary's Hospital in Mumias after showing Ebola-like symptoms. A statement by the Ministry of Health released on Saturday, however, confirmed that samples taken from the patient and tested at the Kemri laboratory in Nairobi returned negative results. The Ministry of Health further assuring Kenyans that it has heightened surveillance along the border and is discouraging movement in and out of the country through entry points along the western border, save for unavoidable circumstances. A call coming barely a week since the ministry gave an assurance that the government is on course with plans to prevent and manage the Ebola virus.
Surveillance efforts are in top gear, and everyone, if nothing is being left to chance. We were preparing also to make sure that everyone who is going to respond to the pandemic has the right tools at the right time so that we also don't lose healthcare workers. Solidarity forever.
Healthcare workers have dismissed the assurance, claiming that the government is ill-prepared.
It is one thing to say that we are prepared as a statement, and it is one thing to actually be prepared and have confidence as healthcare workers and as population that in case we have a case of COVID or an incident of Ebola, then we are safe.
According to the KMPDU Secretary General, Dr. Davji Atela, healthcare workers who are supposed to be at the front line in managing the deadly virus lack protective equipment and the know-how.
It is the time that even we need the PPEs in different parts of the country so that the healthcare workers can be confident that if a case is identified anywhere, then they will not be in a mission to die, but a mission to save lives. It's also important that there is deliberate effort from both the Ministry of Health and the county government to educate the healthcare workers.
The healthcare workers are also calling for intensified border surveillance, public sensitization, reinforcement of the health workforce, as well as equipping hospitals in high-risk counties. Their concerns coming at a time when Uganda's Ministry of Health has confirmed the death of a Tanzanian doctor who contracted Ebola. A tweet by the Minister of Health stated that 37-year-old Dr. Mohammed Ali died in Uganda while receiving treatment after he had tested positive for Ebola on September 26, 2022. According to the Center for Disease Control in Africa, 23 Ebola-related deaths have been reported so far in Uganda.
Cumulatively, as of yesterday, 43 cases, including 24 that are confirmed, 19 that are probable, and 23 deaths have been reported in Uganda. In addition, the government has documented 425 contacts, have listed them, and are monitoring 30% of them who are considered to be relatively at higher risk.
The Ebola virus disease multidisciplinary task force established by the Ministry of Health in Kenya has identified and listed 20 counties considered to be hotspots. Safin Acheng Oma, Citizen TV.
And leaders from northern Kenya are asking